Hey guys, so we are starting a new chapter. This is chapter 21, and it is going to be on systems. So we're starting systems from here on out, from chapter 21 all the way to the end for 26. So every chapter will be a different group of systems and the infections associated with that system. So right now we have skin and eyes. Skin and eyes for chapter 21. So skin infections, we are going to have lots of lovely pictures, by the way. For like every chapter from here on out, you're going to see some pretty nasty pictures coming up. Pictures that have been flagged from YouTube because they are graphic photos. So we are going to have pictures of all sorts of stuff here. We can have, we are going to have acne in this picture and folliculitis over here. Acne over here. Well, we are going to have irritated hair follicles. Every time we start a new chapter with different systems, we have to talk about the anatomy of those systems. So the first one we're going to talk about is skin. But before we get there, we got the case study for the chapter. So in this case study, it's Sam. He is a freshman and he likes to sleep. I feel you, Sam. Sam nicked himself shaving, trying to rush and get ready to go to class. And he didn't really worry about it, but 2 days later, he noticed that it's all red and warm to the touch. So it's red and inflamed. And then when he touched it, it started oozing pus. So he decided he had better stop by the university's clinic. My child is in the room and she's making faces as I am doing this video. There's lots of disgusting things in this, Charlotte. All right, so he had a wound. He cut himself. It got infected. It's red. It's nasty, and it's oozing pus. So he stopped by the clinic, and they took a sample, and then cleaned him up really well. And then we're going to follow and see what's going on with Sam and the wound on his face. All right, so anatomy. We're talking about anatomy of the skin. We have to talk about the layers of the skin, and outside is going to be outside is going to be epidermis. We learned all these when we were in AP1, but just in case you're taking AP1 and micro at the same time. Epidermis, outer layers, and there are different stratums within those. We learned the come let's get sunburn for all of the different layers, with stratum corneum for C being on the outside most layer. Stratum corneum, and that is going to be the outermost one all the way down to the basal, which is our basement layer, before we go from epidermis to dermis. And so now we're in the dermis section. We have all these dermal ridges here, signifying that we are down in the dermis. And then below that, we would have hypodermis, where your fat may be stored as insulation and long-term energy storage. So those are layers: epidermis, outermost layer; epithelial tissues, we all know from AP, epi is always on the outside. Connective is going to be the dermis, and then underneath that, hypodermis as far as layers. When we talk about the cells on the skin, those guys, that type of epithelial tissue was stratified squamous being those flat pancake-like cells, and it's stratified because it's lost lots of layers, because your skin is going to undergo lots of abrasion and we need to protect it. Something special about the skin too is that these are keratinized cells. They are water resistant, to try and keep what's outside and what's inside. So it's going to keep the skin dry, and when it is dry, that should reduce microbial growth. We do have areas of the skin, depending on what part of the body we're talking about, that are more dry than others. So that's epidermis. Dermis is going to have all the stuff below the epithelial tissues, where we're going to have blood flow and nerves and lymphatic. And you can see we've got our hair follicle over here in the dermis. Attached to the hair follicle is going to be sebaceous glands that can then get plugged and blocked and cause acne if this pore with the hair gets blocked and inflamed. We have sweat glands coming out those eccrine glands. We talked about lymphatic, we talked about blood. And then down below that would be the fat and the hypodermis. And here is our nerves and different receptors. And there was lots of different types of receptors from Meissner's and Pacinians and tactile discs and all that stuff that we learned before. Those are here in that dermal layer. Hypodermis, fat. So we said that your body, your skin is a protectant for you, but it also is going to house microbes because your body is chock full of microbes. I'm sure I've said this in this class lots of times, but you are covered inside, outside, all over in your own biome. You have bacteria everywhere, all sorts of places. And so they have mapped them out with the normal microbiota of the skin, and they put them in their classifications for actinobacteria, Bacteroides, cyanobacteria, proteobacteria, and kind of color-coded those groups. And then they took samples of different places, you know, on the body, on your back, in the armpit, all sorts of places, to where behind the ear, the gluteal crease. Yeah, who wanted to sample that one? But anyway, you can see all of the rainbows of colors, which translates into a plethora of different types of bacteria that are living on your skin alone, not to mention your gut bacteria and all of those guys too. So we can see lots of things living on the skin. You are going to find bacteria, you are going to find fungi, you are going to find even viruses that we didn't really talk about before, but you have a biome of all of these things living on you and inside of you, doing their thing, and usually everything is okay. There are some terms that we will talk about. Oh, excuse me. And we have pictures of these. There are going to be lovely pictures of some of these. Some of these are honestly more gross than others, but it is what it is, and we're going to push on through. So, if you've got a wound that has started to, it's still in its one position, hasn't like gone someplace else, but it's starting to swell and get more and more infected, it's an abscess. If you have a blister, it's a BIOL. Carbuncles are going to be basically big furuncles, which are boils, pus-filled abscesses from a hair follicle. And so when you get enough of the furuncles, it turns into a carbuncle, which is deeper, a bigger, gigantic abscess, pimple, a giant one, like that one. But anyway, so they're not always pus-filled. If you see pus, you're going to pus. Purulent is something that produces pus. If it's an infection, pus-producing infection is pyoderma. If anybody has a pet that has been bred in the past, it has worked with rescue groups before. One of the advocates' reasons why you would spay and neuter is to prevent pyometra, a pus-filling infection of the uterus in dogs and cats. It can happen in the females, and it actually took out my neighbor's dog, who wanted to be a backyard breeder, and she lost her dog due to pyometra. So if you see pyo, think pus. Nobody wants to think that, but if you see that term, that's what I want you to think of in your head. So purulent discharge, pyoderma, it's gonna be nasty things like pus. Acne, furuncles, giant ones, carbuncles. If something is oozing fluid, it could crust on the surface. Cysts are interesting. They can be filled with different things. It could be liquid, it could be a semi-solid, and some of them even have gas inside of them. Um, so they are usually, just under the layer there is the cyst. Our first picture that we saw next to the person's acne-covered forehead was to the left, and that was folliculitis, where we have hair follicles that get inflamed. I've seen this on my ladies hiker forum because I hike that AT, and I'm a part of a women's group out there, and we always share stuff. Like TMI medical stuff sometimes, and people have shared that they're getting this hiker's rash and their hair follicles get irritated. They get folliculitis when they're out there sweating and hiking and doing the fun stuff. Macules, they are going to be discolorations. Macules are, but they're smooth, and we're going to have a picture of it. So it's a darker color. It's a discoloration of this color, your natural color of your skin, but it's not raised up. It's going to be smoothed down, versus where we are going to have our papules, which are raised bumps. Anytime you see pseudo in front of something, it just means it's pretending to be. It's fake. It's a poser. Pseudo cyst resembles a cyst, but not quite a cyst. Pustules, fluid-filled bumps. If it's suppurative, pyoderma, purulent, it all revolves around pus. Just, I don't know how many times I can say that word in this video. If you have a blister, a BIOL, and then it is going to break open, now you've got this open wound, you can have a break in the skin or an ulcer. We talked about we haven't yet, but we've talked about it in AP2 when we talk about the GI chapter, and we talk about how Helicobacter can cause ulcers in the stomach, and that eventually it could possibly perf the stomach lining. And that would be super terrible, but now we know what causes ulcers and we can treat them. But they are breaks in the skin in this case for ulcers. Vesicles and wheals. Vesicles are going to be small fluid-filled lesions, while wheals were those guys that we saw that looked like gigantic insect bites that we talked about when we talked about allergies and type 1 sensitivities, hypersensitivities. Wheals were when we saw the picture of the allergy test, and the wheals were the raised bumps on the allergy test when you were reacting to something. Here is a lovely picture of acne. I think everybody everywhere at some point during puberty has had a pimple. I don't care who you are. I'm sure somebody has at one point had one. So you can see the acne on that person's face, and whiteheads and blackheads are still the same thing. They are a blocked pore, and infection is setting in. It is filled with whiteheads, and it just depends on if it has been oxidized, then it's a blackhead, and if not, if it's still covered up and it's not oxidized, it's a whitehead. Lovely things to talk about today. And then we talked about the abscess that is going to be a pus-filled lesion. The colorful pictures of the black and white terms that we just talked about. So if fluid was coming and drying on top of the skin, it is crust. So different infections can cause this, like my daughter had MRSA when she was an infant. All my kids when she was a baby, she'd spit up. And so that spit up gets, everywhere. It's spit up, and babies spit up, is what they do. But she had these little rolls on, babies are chunky. They're chunky. And so she would get some of that spit up in one of her rolls, and it irritated the skin, and she had staph, and she ended up getting a staph infection, and it crusted. That was like the giveaway. I'm like, why isn't this healing? Why isn't this going away? And it's kind of crusty. And so, I took her to the pediatrician, and it turns out that it was MRSA. And she needed to have heavy dose antibiotics at a really young age because of that. But the giveaway for me was this fluid, this crusting that kept happening. And I'm like, that's not supposed to be there on healthy skin that is trying to heal. So crust, fluid, accumulating on the skin from infection. Cysts, we said, were liquids, sometimes semi-solid, sometimes gas, that are just under the surface. Macules were those discolorations, but they were smooth. Papules are raised areas, almost like they sometimes you'll see dermatitis. We got lots of raised little sections like that. Pustules have pus in the name, just like they sound. Ulcer was that deep lesion in the skin. In this case, it's in the skin. We talk about it in the stomach too, if we're talking about ulcers. But they are a break in the tissue. Vesicles are raised fluid-filled areas, but they're small, versus wheals that were much larger, higher, bigger. So these are different types of skin lesions. All right, so we talked about the skin and some nasty stuff about skin, and we're just going to keep talking about skin infections in the next section, but we haven't talked about eyes yet. So let's talk about eyes and eye anatomy to start off this portion of the chapter. So with the eye and parts of the eye, we are going to need to know, we got the eyelids, we have the beautiful iris and cornea, and the cornea is going to be attached to its connective area, the conjunctiva, and we will see that in just a second. Your eye needs to stay healthy and moist, and so you are going to form tears that have antimicrobial properties. They're going to rinse off your eye every time you blink, and so those are coming from the lacrimal gland, and that's always on the lateral portion of your eye. No matter if it's right or left, on the outside is going to be your lateral lacrimal gland, and it is going to produce the tears that are going to come out over here. And then every time you blink, again, blink, 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 and you are going to push those tears across the eye, and you're cleaning your eye every time. It's going to go across towards the medial area of the eye. You got your lacrimal puncta. It's basically these holes, these pores, these ducts that are going to drain the tears away. So if you're upset and you're emotional and you're trying to be a big girl, suck it up, buttercup. That's where those tears are going. So instead of rolling down your face, they're going there down the lacrimal puncta to these ducts, to the lacrimal sac, and eventually down the nasolacrimal duct. So then you get the sniffles, because that's where they're going. They're going to go back down the sinuses. So this is the lacrimal apparatus producing the tears, which are great. They are antimicrobial, and they are going to help lubricate the eye and keep it clean. Other parts, we already talked about the eyelids. We've talked about the cornea, which is the outside layer. If you scratch your eye on accident, like you got a hair in there, dirt or debris or something like that, and you scratch the surface of your eye, it's your cornea, and it's pretty painful when you do that. It's really irritating. Your eye color is going to be your iris. Where? Oh my goodness, excuse me. Where the eye, where the light comes through, it's going to be your pupil, and that's going to allow the light come through. The light is going to come through, and it's going to hit this guy and refract off of it, off the lens, and then that light is going to shine up on all the retina on the backside of the eye. The area with the highest visual acuity is going to be the fovea. Your blind spot is going to be right smack here, because the optic nerve is sitting right there, and there are no rods and cones in that place because you got the optic nerve running out the back of your eyeball. And here is that conjunctiva I mentioned, where we talk about the cornea, and the cornea has to attach onto the eye and keep its position, is conjunctiva. Humors, they mention vitreous humor in the back. So everything behind the lens is vitreous humor, and that is more jelly-like. Where in front of the lens is going to be aqueous humor. It's not mentioned on this picture at all, but it's more watery on the front side, on the anterior part of the eye, on the anterior part of the lens. This area here is aqueous humors, And this behind the lens is vitreous humor. Infections of the eye. Conjunctivitis is just like it sounds when the conjunctiva is infected. So pink eye is that. Blepharitis, I have never seen this one actually in real life, but we have a picture of it, and it is inflammation of the eyelids. So look at this one compared to this one. That is some interesting stuff there. Blepharitis, eyelids. Conjunctivitis, the conjunctiva. And then if we were talking about the cornea, if the cornea was inflamed, infected, keratitis. So we can see in this picture right here, they've got keratitis going on, where that cornea is all infected and all white, and it looks like it is very hard to see. Different infection types. If we see acute, that means it's going to be really strong. We already talked about what purulent means. And then the location, it's in the conjunctiva, so conjunctivitis. Ulcerative or hemorrhaging, we talked about what an ulcer was. Hemorrhaging is bleeding. Keratitis, we mentioned that already. Keratoconjunctivitis is going to be both. Instead of just cornea like keratitis, it's cornea and conjunctiva. Papillary conjunctivitis, non-ulcerative. So there's all sorts of different types of infections going on involving the eye, around the eye, the area around the eye. So that is the first video, and then we'll go into, every time we do a system, it's going to break it down the different groups. So it's usually bacterial, and then maybe we'll do fungal, maybe we'll do viral, and then the helminths. And we kind of do this through all of the different chapters. So next video will be a video by itself on bacterial infections.